In my hypothetical situation, Mr. John Doe is a 75-year-old man living in Talkeetna, Alaska, which is a rural area in Alaska. When Mr. John Doe reports his incident to his caretaker at the assisted care living center, since there are no 24-hour emergency rooms, the best she can do is call an on-call medic, and what he'll do, he'll evaluate the patient and refer him to a specialist. If the situation were life-threatening, an air taxi would be called and Mr. John Doe would be taken to the nearest major hospital, which is in this case an hour away at Wasilla Matsu Regional Hospital. If not, then he would just have to wait till the next morning to go see his doctor. The major hospital in Talkeetna is Sunshine Clinic, and they do have a transit to Willow and Wasilla, but not to Anchorage. So any travel to Anchorage will be at his own expense. There are a limited amount of GI providers in Alaska, and one facility, Alaska Digestive and Liver Disease, has 3 preferred Medicaid providers. So he will have to see one of those 3 doctors so that his insurance covers it. Suppose after his appointment and his consultation with the doctor, he is diagnosed with hepatitis C, which would explain his symptoms of rectal bleeding. In order for Medicaid to cover treatment of hepatitis C, you have to meet certain criteria. You have to have chronic hepatitis C, and your level of fibrosis have to be 2 or higher, which means you have to have some kind of liver damage in order to get treated. If Mr. John Doe is not sick enough, he will not receive coverage for his treatment, and the medication will run him about $100,000. Cost seems to be the most common issue when it comes to receiving care. In John Doe's case, on top of cost of care at the assisted living facility, which in the nice one in that community was $6,000 per month, he's still gonna have to pay for other things like the travel up to Anchorage, the stay. Any labs, sometimes Medicaid doesn't cover all the labs. They may not cover his prescriptions. So there are many cost variables to think about. In regards to the 6 aims, I think the area that Mr. John Doe lives in has both positive and negative attributes. While the services that are allocated to him are effective, I mean, he gets treatment, they're equitable, it's fair treatment, he has coverage, they don't discriminate, and it's patient-centered. From personal experience, I can say that the patient is involved in the treatment of care. They are presented options, and the patient can choose which options they want to take. But the methods by which the treatment is initiated is very risky. Like I said, I work in a similar environment, so I know that if the patient isn't sick enough, sometimes Medicaid won't cover the treatment. And in this case, hepatitis C, the pills for these can be anywhere from $50,000 to $150,000, and not a lot of people can just afford that out-of-pocket cost. And because of this, patients are forced to wait until they are sick enough, which is a risk. It makes it untimely. It's not safe, because while the patient is getting sicker, in the long term, yeah, they'll be treated for hepatitis C, but that liver damage is irreversible. It makes the process inefficient because you're curing one illness, but you're making him susceptible to even more. Where I work, I deal with a lot of patients that have Medicaid, so I'm very familiar with how that insurance works. I can say that it's improving. Before, a patient had to have a fibrosis level of 3 before they can get the treatment. Now they brought it down to 2. So you still have to be sick, but you can be less sick than you had to be before, which is still a backwards process to me, but it's a step forward in a sense. And these are the sources that I got it from. Thank you for watching.